Hi everybody, Marcos Ubieta. So today we're going to talk a little bit about some exercises for the lower body. So first, starting off sitting in a chair, we're going to go over leg extension and flexion at the knee. So here we see from the seated position, we have leg extension at the knee, and the muscles involved in this motion are the quadriceps. So that's the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis, right? So that's knee extension, leg extension, and then we have flexion here. So the muscles involved here, the muscles of the hamstrings, or the biceps femoris, the semitendinosus, and the semimembranosus. So this exercise, the articulation that allows this movement is obviously the knee. We're starting in this seated position here, and if you wanted to add more resistance, you could take a resistance band, and I don't really have anything to tie it with, but you could tie it maybe to the chair for extension and to something else for flexion. Okay, so now we're going to go over a variation of that exercise. So as you see, when we started in the seated position, our glutes and our thighs were stabilized for us. We didn't have to do any of that work. So a nice variation you can do to maybe increase the difficulty a little bit is laying on your back. You can do it on the floor or on a bench, so you're laying supine. You attach the resistance band to your foot. Go ahead and lay in this position, and then you're going to perform with your thigh flexed. You're going to perform the same movement now here with the resistance. You see the leg extension, flexion. So that's just another variation of the move where now you have to stabilize your thigh and your glutes. It makes it a little bit more difficult. Okay, so the next exercise we're going to be talking about is the clamshell. So for this exercise, you're going to want to lay down on your side. Now, you're going to keep your feet pinned together. They're going to be in a neutral position. You're going to have your thighs and your knees both flexed to form kind of a 90-degree angle. And on your side, basically, you're just going to externally rotate the leg and close it, keeping the feet together, so you're focusing all the work on your gluteus medius. It's also going to be working your gluteus maximus, minimus, and also your quadratus femoris. Okay? If you wanted to make this exercise a little more difficult, you could wrap a resistance band around your knees and do it that way. Also, the articulation that allows this movement is at the hip joint. Alright, so the last exercise we're going to be doing is what's called a lateral squat walk. It's also called a crab walk or a sumo crab walk. These are great for physical therapy. I've done them for physical therapy for my knee because it helps a lot with your knee stability. The way the exercise is going to start, you're going to start in a squatted position where we're engaging our glutes, our hamstrings, and our quadriceps. And the way the exercise is going to work, you're going to take a resistance band. You can put it on your ankles or your knees, whichever. Alright, and then you're simply going to walk to the side and bring the leg trailing. The other side. So this exercise, as far as the muscles that are used, is very similar to the clamshell because you're using your gluteus medius and minimus a lot. The articulation that allows this movement is mostly your hip because it's kind of a hip abduction, but also your knee and your ankle is somewhat involved because you're having to keep stable the whole time. So that kind of wraps it up. Thank you very much.